partner on, if we can share resources, stuff like that. And in one of those meetings, it was suggested we should do an event. And here we are. So the goal of today is just to reintroduce ourselves, talk about ourselves, what services we offer, and provide how to access our services, like that. I think what we want to know is we want everyone to walk away with information. We want workplaces to be healthy and safe. We want everyone to have a long healthy working career, and more importantly, a long, healthy retirement after working. So next, I'll move to the land acknowledgement. We will begin by acknowledging that we are meeting on the Aboriginal land that has been inhabited by Indigenous people from the beginning. We wish to acknowledge the Robinson-Huron Treaty from 1850. We also further recognize that we are located on the traditional lands of the Anishinaabe and include Monomote First Nations. We recognize and deeply appreciate their historic connection to this place. We also recognize and contribute the contributions of Métis, Inuit, and other Indigenous people who've made both in shaping and strengthening the community, our province, and our country as a whole. So next, we'll do a moment of silence to acknowledge all those whose lives have been affected by occupational disease and injury. Thank you. So then I'll move to a couple of housekeeping items. We have a pretty tight agenda, and I will do my best to keep us on track. We won't be taking questions, but we will be putting our contact information into the chat. So feel free to reach out afterwards to continue the conversation. And for those of you who are in person, we will be sticking around afterwards. There are 2 washrooms and near the training room, as well as a single-use washroom in the reception area. For smoking is strictly prohibited on WSN property, so please use the designated areas. Cell phones, so please make sure your cell phone is turned off. So if you need to take a call, the lobby, and the doors, and please make sure the doors are closed for the duration of the session. And as for emergency procedures, in case of emergency, we want to report immediately to the reception area. Remember, 911 should be the first thing we do. And just be aware there's lots of us in the room and lots of cords, so just be careful. And of course, we will be taking breaks as we go. To the welcome slide. Here we are. So I'm actually leading us off. So like I said, my name is Brittany Ramacco, and I'm an Executive Director at the Occupational Health Clinics for Ontario Workers. It's quite the mouthful. So we use the acronym OCAL. So OCAL was established in 1989 to act as a resource to workers and employers to provide objective scientific information and focus on prevention of occupational health problems in the workplace by providing services designed to produce changes to improve workplace conditions and the health of workers. So we were established with the efforts of the labor movement and the United Steelworkers. So our vision is the detection, prevention, and elimination of occupational disease, injuries, and illnesses, and the promotion of the highest degree of physical, mental, and social well-being for all workers. Our mission is to protect workers and their communities from occupational disease, injuries, and illnesses, support their capacity to address occupational hazards, and promote the social, mental, and physical well-being. So next here, I've got a nice little layout of the province. It shows each of our clinics, where they are, and the years they were established, and the catchment areas that each clinic covers. So we used to be very catchment area orientated. It's more recently that we've removed geographic barriers and become the OCAL without fences, acting more like one large clinic. So how is OCAL unique? So we focus on occupational health issues versus traditional safety issue focus. We have an interdisciplinary approach. So we have occupational physicians, nurses, occupational hygienists, ergonomists, coordinators, and leadership and provincial office staff. And there are no charge for our services. So who uses our services? Well, pretty much anyone. Workers, joint health and safety committee members, unions, employers, managers, doctors, nurses, and community groups. So how can OCAL help? So I really like this little pyramid that we've put together. I like the idea of the medical side and then the occupational exposure side and the work relatedness being in the middle, because that is where OCAL would sit. And I will cover more as we go. So OCAL provides the following services. So our clinical services for workers who have a work-related health concern, group services providing educational and investigative support for joint health and safety committees and workplace parties, inquiry services, so to answer questions, outreach and education services, and research services. So each of these I will go over in this slide. So our clinical service, this is our bread and butter and really what makes OCAL unique. So when I refer to clinical services, I'm referring to an Ontario worker, past or present, who has an injury or an illness. The first step would be for that person to seek medical treatment. But if you believe your injury or illness is work-related, you should contact the WSIB and initiate a WSIB claim. The WSIB will launch an investigation and provide a decision on your case determining whether it is work-related or not. If the WSIB accepts your claim, they acknowledge the work-relatedness, and OCAL would not get involved, our services would not be needed. But if it's denied, you would then like to appeal that decision, you can come to OCAL and use our services. So anyone can contact OCAL, so a worker, a state, a legal advocate, a union rep. You can come, you can call, you can come by the office, email. We do have some contact forms on the website to contact us, an advocate referral form you can print off, you can complete. And that would connect you with a client service coordinator. They'll ask you some questions, collect some of your demographics, things like that, ask you for your WSIB claim, or at the very least, at least your decision letter. The client service coordinator then would present your file to our central intake team to confirm it meets OCAL's mandate, and then it would move on to more information gathering. So that would be consents, there might be some questionnaires, the occupational nurse might interview you, requesting medical records. Once we have it all, it goes to case management. So our nurse case manager would help patients understand the goals and expectations goals and expected outcomes of our services, identify the patient's overall needs by assessing their issues, history, and claim progress, attempt prevention if needed, develop a comprehensive report based on work, exposure, and medical histories, act as a patient advocate to help other team members understand the patient's need, and continuing of care and act as a liaison between various professionals and external services, and evaluate and monitor each case file status. Then we would move on to our interdisciplinary team meeting. It's also quite the mouthful. This would be a meeting of team members who would look at the file and develop an action plan. So this would be, that would involve the nurse, the coordinators, an ergonomist, maybe a hygienist, a physician, and they would decide how they would action the file and then how they're going to execute it. And then it would go into queue to be processed. This is usually the longest process. So the file sits in queue until it is ready and it has the team member has availability to work on the file. And then would come the actual report writing process, the research, report writing, peer review, and creating a finalized report or reports, which you could use as part of your WSIB appeal process. So two additional facts I want to mention is if you do use an OCAL report in an appeal and it continues to be denied, you can recontact OCAL with the new denial and ask the team to have a look again at the file, see if they can comment further. But the other note I wanted to make is that if your claim is accepted, that's also, we'd like to know that too. We have a nice repository that we try to collect when we have positive outcomes and then the reports that go with them. That is usually where the team starts when they start their investigation, their research portion. They want to make sure if there are any previous reports that were successful, that's what they like to start. Okay, now that I've talked about what we do, let's talk about what we don't do. We don't treat, we don't diagnose, we don't replace your healthcare provider. If our team believes that you need to get some further testing is needed, we refer you back to your family doctor to get a referral. We don't tackle non-work related issues. We don't tackle return to work, fitness for work, modified work, MSK issues, multiple skeletal issues that are from 10 years ago. Any permanent impairment, level of disability, WSIB case management or legal advocacy, or any disability claims. So in this chart, we have a list of occupational cluster investigations that we are also currently working on. This is included in our clinical work. So the column on the left shows the cluster investigations that we received additional funding for, and the column on the right shows the cluster investigations that are being worked on through our central intake process. So the most popular ones around this area, you would probably heard of the McIntyre Powder Project, Neon Castings, Hip Creek, Oklahoma Steel. So occupational disease cluster investigations are open at the request of individuals, worker, organization, and community groups who suspect that health conditions that a group of workers have in common were caused by exposures in their shared workplace or industry. OCAL approaches these recorded clusters at both the group and individual level, pursuing several goals. So evaluating common exposures and identifying those that should be reduced or eliminated. So that's your primary prevention. Screening individuals for early signs of disease so that treatment can be mitigated to mitigate harm and workers can avoid compounding exposures. So secondary prevention, and then providing assessments. So next, I will talk a little bit about the McIntyre Powder Project. It's a very popular one. That's a nice picture of my coworker, Janice. So for decades, workers in Ontario mines were required to inhale a substance known as McIntyre powder before they started their shifts underground. It was believed the powder, composed of aluminum dust, provided protection from lung damage. And since then, many miners who worked during those years suffer from neurological and other physical ailments. The McIntyre Powder Project is a voluntary registry established by the daughter of one of those miners, Janice Martel. Its purpose is to document health issues in those who were exposed to the powder in their workplace and conduct research into the long-term health impacts of aluminum dust exposure. Ultimately, a compensation can be sought for those workers who suffer from health issues related to their occupational exposures, as well as legislative changes to improve safety in workplaces. And Janice works out of our Sudbury office. So we have done lots of work with McIntyre Powder. And in fact, we have a whole web page dedicated to our work there. So that would be where I would, if you were looking for any resources regarding McIntyre Powder, that's where I would direct you to. So we've done lots of work from research papers, pilot studies, and I know Janice has been a big advocate traveling all over the province, just educating people on McIntyre Powder. Okay, moving to our group services. So an ergonomic assessment. By definition, ergonomics is the study of the relationship between workers and their work environments. The aim of ergonomics is to match the job to the worker to reduce the strain placed on the tissues and to prevent injuries. OCAL offers ergonomic assessments, and we have 3 parts to an assessment. So education, so providing education sessions on a variety of topics such as office ergonomics, manual material handling, and how to conduct a physical demand description. So workplace Workstation assessments, providing workstation assessments in a variety of settings such as office, manufacturing, education, and transportation. And ergonomic hazard identification, assists worksite personnel in identifying potential ergonomic hazards and providing recommendations. So similarly to the ergonomists, the hygienists also look at the chemical, biological, and physical hazards that can lead to the development of disease and develop strategies to reduce these hazards, including engineering, administrative controls such as ventilation and noise measures. Our occupational hygienists also conduct education sessions, workplace assessments, and hazard identification. So we also provide inquiry services. So you can contact any of the OCAL offices to ask work-related questions. So, for example, the steps that I work on, common diseases in your industry, ways to reduce or eliminate the hazards you face, or the latest medical and scientific findings. And just a reminder that this is, again, at no cost for you to call one of the offices and speak to an ergonomist or a hygienist or a nurse. Next, moving to outreach and education. There's something OCAL staff like to do, it's talk. So you can find us at lots of booths, at conferences, and we love to give webinars. I would point you to, again, the website is where we have our upcoming webinars, and our newsletter, The Lens, is where you can get the latest information on that, and I'll like to speak to that afterwards. And our research services. So OCAL collaborates with researchers to identify, investigate, and prevent occupational illness, injury, and diseases. So bridging the gap between academia and workplaces. And each staff member continues to keep updated on their field of specialty and attending and presenting papers to colleagues at professional gatherings. We don't do much of this around the Sudbury area, but we do around in our southern clinics. So I did want to mention it. But every year, thousands of temporary foreign agriculture workers come to Canada to work in the agricultural industry, including 20,000 arriving in Ontario to work in farms and in greenhouses. These workers play a vital role in the industry and therefore in Ontario's economy. The Provincial Expert Advisory Panel on Occupational Health and Safety, and subsequently the Ministry of Labour, have identified this labour force as a group who face barriers in accessing effective occupational health and safety resources and support. As migrant farm workers spend the majority of their time at work, the farm work can be physically demanding, involving a variety of hazards, and occupational health and safety focus is particularly important to supporting the health and safety of this population. So since 2006, we have offered our services to migrant farm workers, their employers, and community members. This is a photo of, this is my coworker, Eduardo, at the Suntech greenhouses giving a presentation. That's it for me. So I'm just going to pass it off to my co-presenter, Kate Ingenio.
Hi everyone, my name is Kate White-Key and I'm the Science Translation and Community Outreach Specialist here at Sudbury. So I take a lot of the reports that we do and turn them into more digestible materials and resources like infographics, posters, videos, that sort of thing. So I'm going to take you through some of them that we have today. So to start off, we have our workplace mental health resources. So that includes Stress Assess, which is a survey of psychosocial factors in your workplace. We also have our mental injury workers guide to addressing workplace causes of mental distress. And even in the pandemic, we also did a survey for healthcare workers and their experiences during the COVID-19 pandemic. I also wanted to highlight ergonomics because this month, October, is Global Ergonomics Month. And this includes the initiative that started throughout summer and fall with OCAL, the ministry, WSPS, WSN, with hand-arm vibration syndrome, or HAVS. And with that, on our YouTube channel on Oak House, we have a 3-part video series that talks about what is hand-arm vibration, what is hand-arm vibration syndrome, and then prevention strategies for it and diagnosis. And with ergonomics, we also have our office ergonomics e-learning, we have our reference guide, and we have a variety of handouts as well. So up here today, we have our back to school for educators and students with ergonomics, and a variety of apps that you can find on either Google Play or on the App Store as well, depending on what kind of device you have. So here we have our Office Ergo Calculator as well as the keyboard shortcut tutorials. So these are some of them that we wanted to highlight, and you can also find them on our website and as well as on our social media, especially throughout October. We also have lots of resources for occupational illness prevention. So a few I wanted to highlight today is our Hazard Assess app, our Air Assess app, our Quick Exposure Check QEC calculator, and our Occupational Exposure Limits OEL adjustment tool. I also wanted to highlight our heat stress toolkit that was in partnership with Prosh, and we'll go into more detail later, as well as the silica control tool. So for those of you who do not know the silica control tool, it's a free online tool for use in workplaces where respiral crystalline silica may be generated during construction activities. So I just wanted to show here that users, once you get an account and log in online, you'll be able to select what kind of construction activities through a drop-down menu and the duration of time. And then an exposure estimate will be created, as you can see on the top, without controls and way over the occupational health limit. And then afterwards, we add different control measures that are suggested by the tool. And then afterwards, it'll be recalculated through the tool, and respiratory protection will be suggested, different ones, as well as, if you see on the far right side, an ECP or an exposure control plan. I also wanted to highlight that for 2025, we now have the surface mining silica control tool. So it's the same as our original silica control tool, but instead of focusing on the Ontario construction sector, we're now focusing on the Ontario surface mining sector. And so when you go to the homepage, you'll be able to go in between the two tools with the same accounts. And again, all free. I also wanted to highlight, so these were some of the infographics made through the Temporary Foreign Agricultural Worker Program, and the importance to, yes, we do have them in English and French, but also in the workers' language. So for here, we have Spanish, Thai, and we also have a whole bunch of other additional resources, whether that's our podcasts, webinars that have been recorded, videos, information sheets, posters, anything you can think of all in between, including our e-newsletter that comes out and you can sign up for as well. I also wanted to finally wrap up with some of our most popular events. So every February, we have our RSI webinar series that happens. In April, we have our Spring Attention and Safety Forum. In May, we have our May Day Workplace Mental Health webinar series. And then at the end of October, throughout November, we have our October and Beyond webinar series. And speaking of that, so our October and Beyond series is going to be starting on October 30th and every Thursday until November 27th from 12 until 1:30 p.m. So there's still lots of time to sign up and join us for those 5 weeks. And that's all for today. If you have any more questions, comments, please reach out to OCAL and we'd be happy to help you with any of your occupational health concerns or needs. Thank you.
Hi, everyone. Welcome to Workplace Safety North in Sudbury. My name is Lindsay Digby. I'm the manager of Health and Safety Services here. I'm going to go over a couple of things with you today about who we are, who we support and how we support each other here in the room in terms of the prevention system. Clicker. Go. So our sectors that we support, as you see on the slide here, are basically the natural resource sectors. So we have things like forestry, and in that category, you'll see structural wood, logging, conventional or mechanical. And then we have milled wood products. It includes wood container, pallet manufacturing. We support sawmills across the province, silviculture, veneer, plywood, wood preservative. Some of the other categories in forestry that we also support are things like nursery and tree production. We have maple syrup products and production, which is awfully yummy. And then window and door manufacturing, just to name a few others. How we understand as a prevention system who we support is based on the NAICS codes. NAICS stands for North American Industry Classification System. And so these are just those categories that we support. Moving on to paper printing and converting, you can see here that we've got corrugated solid fiber boxes. We also have folding cartons, paper products, printing, plate making, and binding, pulp paper, newsprint, and specialty paper. We also have stationery products, paper and manufacturing, and digital printing. So these are part of the sectors that we support in this category. And then, of course, our mining group, where we have our mine rescue, nickel and copper mines, gold and silver, so anything extracted from the ground, we would support those operations, salt and gypsum, drilling, and any other support activities, including granite, marble, and I believe I already mentioned gypsum. So who is Workplace Safety North? So for those that are joining us online who may not understand the prevention system in general, the group of people that we have here in the room in Sudbury today are part of the prevention system in Ontario. And how that prevention system works is, if I'm going to steal Pam's speech a little bit from what I learned several years ago about how the prevention system works. So we have the prevention system, which is made up of health and safety associations and partners across the province that are working on preventing illnesses, preventing people from getting injured in the workplace. We're like your driver's ed. Okay? If you want to deal with us, learn about the things that can hurt us, teach us how to be a little bit safer. Then part of that prevention system is the Workplace Safety and Insurance Board. Okay, so that's your insurance, right? If we're dealing with the WSIB, it means potentially we've gotten into an accident and now we're having to source out that support from WSIB. Then also part of the prevention system is the Ministry of Labor. That's like the police, right? So we don't want to be dealing with the police because it's not a place that we want to be at. It means something went wrong. We don't necessarily want to be working with the WSIB. It's because we've injured someone. So the health and safety associations and the prevention system at our level is kind of like that driver's ed. You want to be using us, you want to be interacting with us because we're all about prevention. So Workplace Safety North supports the natural resource sector in all of Ontario. We are a small team of, very small team of less than 75 across the province, 20 of which are our frontline health and safety specialists that are spread from Dryden all the way to Kitchener, over to Ottawa, and everything in between. So there's about 20 of us that get in the field, do the training and consulting activities across the province. Supporting the health and safety services team are education services. We wouldn't be able to do what we do without that team of 9. And they're an incredible support in creating some of the training resources and materials that you'll see on our website that we hand out during events like this and during our training. And then, of course, we also have our corporate and client experience team, which again keeps us in check, keeps us in line, and makes sure that we're doing the things we need to be doing to remain relevant and be in existence here with us today. So that's about a team of 17. And then, of course, we have our Ontario Mine Rescue folks who make up about a team of 24 across the province. At every mine site, there is an Ontario Mine Rescue officer dedicated to supporting those services at all the mines. So a couple of the things that we do, and I'll get into the details in a little bit. We provide consulting services, so everything from a basic health and safety question to an audit or an assessment. We provide those services across the province. We have dedicated folks who are supporting industrial hygiene services. So everything from helping you develop your air management program to testing for radon. Those are some of the things that our industrial hygienists can support you with. We also have continuous improvement resources. So we're all about the continuous improvement journey. And so again, give us your problem, we'll help you find a solution. And then we also have a mental health or psychological safety suite of resources as well. So this is just to touch on who we are, and our vision really is much like the rest of the prevention system partners in the room is every worker home safe and healthy at the end of the day. But I also like what Brittany mentioned, to be able to enjoy retirement as well at the end of that workday. Okay, so we're gonna dive a little more deeply, see what we did there, into how we can help. So if we take a look at the scenario, a mining operation wants to improve its health and safety program. Okay, we're going to show you how actually connected we are to the other system partners in the room here. So who is typically in a mining operation? Historically, we've had equipment operators, we've had development miners, mechanics, millwrights, surveyors, supervisors, laborers. And I'm sure there's missing a few, okay? But who else is in a mining operation? We've got geologists, engineers, industrial hygiene specialists, and others that support our mining firms, including health practitioners at remote sites, camp personnel in terms of cooks, and site services, which would focus on housekeeping and making sure that turnover is taking place, keeping things operating. And similar to forestry operations, so if we think about remote forestry camps, these would operate in very similar ways. We would have various individuals who would support very similar jobs at these locations. So how do we support one another? So Workplace Safety North, of course, supports our natural resource sector, but the other associations also have the ability to support those activities in a number of different ways. We can't be everything to everyone, and so that's why we rely on our system partners to be able to help us with that vision of sending workers home safe and healthy at the end of the day. Because again, we're small and mighty, we're across the province, there's 20 who deliver those frontline services, so we can't be everything to everyone, and so we have to rely on our system. So the next couple of slides are just going to give you an idea of how WSN works with the other health and safety associations to be able to support our natural resource sectors. And there's probably a lot of other things that are not on these slides, but just to give you a brief example. So Workplace Safety North, we provide the mining employees from the surveyor to the supervisor with our Common Core First Line Supervisor Suite. We also have technical specialists that will participate in our ground control training, mine vent, and complete assessments as well. IHSA supports WSN and our firms by providing contractors that come to these sites with ministry approved working at heights training as an example. They also have their surface miner common core for the pit and quarry personnel. And so there's a direct relationship between the employees that IHSA supports and the sectors that WSN supports. So if we move along, we've got Public Services Health and Safety Association. We have nurses and healthcare professionals that are at these remote mining locations. And so PSHSA supports that workplace well-being component. They've got a ton of resources surrounding the healthcare industry. And so we often will make recommendations that our clients source out PSHSA to support those individuals. They also have a plethora of resources for the emergency services group as well. And then we have WSPS. So again, you know, we've got manufacturing taking place at some of these operations. So we've got racking and storage expertise in WSPS that, again, we may not necessarily have that at WSN, but one of our health and safety system partners has those experts at their fingertips. And so we would leverage and make a recommendation to our client to reach out to WSPS for that, including service providers, so cooks, line cooks, those types of jobs. We also have that connection with WSPS to provide information and resources to the food services industry. Okay, so a few other system partners. So Brittany had mentioned how OCAL supports the province already. So OCAL will sometimes provide support in results interpretation, also cluster investigations, as she mentioned. There's also those clinical services, the hygiene and ergonomic assessments. So again, we sometimes have to tap into these resources across the province. And then the Workers' Health and Safety Center. Of course, they have a local presence here in town, which is fantastic. But they provide training services to the sector. And for those who are in the room, there's several handouts that show you exactly how they can support as well. So again, we provide various training across the province, but there's lots of workers and we need a lot of support to be able to make sure that our teams are going into the field with the knowledge and know-how to keep themselves safe at the end of the day. We also need some support from research partners like Crush, who at times help evaluate the effectiveness of training and controls and provide us with some really great resources that you'll learn about a little bit later today. So there's a lot of cross collaboration that takes place. We certainly couldn't do this alone, especially from the system partners that are in the room today. So I do, want to thank all of the system partners for everything that they do. And of course, your broader membership here today for the efforts in trying to reach this collective goal of making sure our workers go home safer and healthier at the end of the day. So a little bit more about how WSN supports. So we've got information, of course, that's available everywhere on our website. If you talk to one of our specialists, they also enjoy speaking your ear off, especially if they're passionate about various topics, including myself. Lots of resources. We do training across the province of Ontario, ministry approved working at heights, JCERT, mental health suite of services, Common Core for supervisors. There's a ton of stuff that we do. And if you're looking for more information, you can check out our website for the number of training sessions that we have to offer. And then consulting services. So again, as I mentioned earlier, if you have a problem, let's talk about it. Let's try and figure it out in all things health and safety. And then of course we host events. So one of our big events that we host annually is our Mining Health and Safety Conference here in Sudbury, which is well attended by the local community. And we're looking forward to hosting again next year. All right, so how do we support that safety journey? So whether you're starting your journey or you're at the continuous improvement phase or focused on excellence, we have tools and supports for every stage of that maturity journey. And if you don't know where you're at in that journey, we have a tool for that as well. So I just want to thank each and every one of you for joining us here today. Once again, these are some of the resources that we have available to each of the sectors. Some of it does cross, I don't say contaminate, but cross-pollinate is probably a better word to use. So things like Common Core professional chainsaw cable skidding. So we support our professional chainsaw operators in the province. Safe driving on forest roads. So this is a very popular time of year for nature enthusiasts, people who love fishing and hunting to get out into the bush, but there are real risks associated with that interacting with our logging operations. And so we do have some e-learning and free workshops available right through our website that, you know, if you have loved ones that are going into the field, great opportunity to check those out and share them with your friends, family, and your coworkers if you travel on those forestry roads for workplace. We also have a program called Safe Workplace Ontario. So it's helping you build your health and safety program. It's very renowned in the forestry sector. And at the end of the day, we're just, again, looking to arm our companies and clients with the best supports to protect their workforces. For mining, we've got, I mentioned Common Core a little bit earlier, mine vent support. We have coaching for performance. This is a fairly newer initiative for us. However, it's proving to be very effective and very popular, where our specialists will go into the field and spend some time with your supervisors and provide you with a report, with guidance, with recommendations on how we can be a little bit more effective at our supervisory roles. We also have mobile equipment safety, radon assessments. That's sort of cross-pollination with the sectors. And then some of the multi-sector items that we have available. So we do some legislative compliance consultations, some auditing. We also have our validated climate assessment and audit tool, or CAP for short. So this takes a look at your health and safety management system and occupational health and safety culture. And we start to overlap the findings when we do this audit to understand where there are gaps between culture and system and how we can actually close those gaps. And it's based on a maturity scale. So depending on where you and your organization would like to go in terms of occupational health and safety maturity, we have the ability to measure that, let you know where you're at, and provide you with guidance and tools to help you get to where you want to be in terms of occupational health and safety and your management system. CPO approved training, so Chief Prevention Office, Ministry for short. And then Health and Safety Excellence Program. We support several organizations in that, much like the rest of our system partners do across the province. We have a psychological safety suite of services, and we also have a train the trainer suite to support upskilling and providing clients with resources to be a little bit more self-sufficient at their own operation. And so we have a number of train the trainer options where we teach you how to teach our program, and then you run wild and free with it within certain parameters. So with that, I want to thank you for joining us. I hope everyone takes away a little something physically, but also learn a little something when you leave. And hopefully you've added a few more tools for your toolbox by joining us here today in person or virtually. So just want to thank you. Thank the system partners for coming together. It's been a long time. It's nice to see everyone, and enjoy the rest of the presentations.
All right, so good morning, everyone. I'm Malcolm Mills, and I'm from the Workers' Health and Safety Center. And today I'm just going to go over a little bit about our services, as some of the other organizations did as well. Predominantly, we're a training provider, and we do offer a couple other services, but I'll cover that as we go. All right, so this is what we're going to look to do by the end of the session, is just understand our working environment, occupational health and safety training laws. I can do a couple highlights on industry standards, our role, our approach, and our capacity, the benefits if you partner with us, and if you have any questions, I think we'll be at the back after the seminar if anybody has any questions. So I start with our working environment. So I think everybody here knows that worker vulnerability, new workers, typically 4 times more likely to be injured on the job than experienced ones. And they're often young workers or students. And it's usually due to exposure to hazards and lack of proper training is typically where we find the gaps. So the employer responsibilities, by law, employers are responsible for hazard control and occupational health and safety training and specific and general duties. So there's a lot of ownership and responsibility for employers around keeping workers safe, but workers also have duties in the workplace as well. So we want to make sure that everything is captured. So job demand readiness. So employers increasingly looking for job ready workforce, workers looking for an edge in securing employment, and additional occupations health and safety qualifications can help. So that can be anything from working at heights training, joint health and safety committee training, asbestos training, anything like that that people are looking to accomplish ahead of time to hopefully advance their careers. So here's a couple of laws and industry standards. So the Ontario's mandatory training standards. So right now there's mandatory training for certification training and joint health and safety committees. So for part 1, part 2, and refresher training. So your part 1 training, after you complete that, you have up to a year to get your part 2 training completed. And once your part 2 training is completed, you need to complete a refresher every 3 years to stay current and to keep your training active. There was a clause that anybody that took the training before a certain date, 2015, your training was good for the rest of your life. But that's since been updated. So now as well, working at heights training. So this came into effect after the tragedy in Toronto on Christmas Eve. So now we have mandated working at heights training. And the first time it's a full day working at heights training program. And then after that, you're able to do a working at heights refresher program once every 3 years to keep that training active. There's also the worker health and safety awareness and supervisor health and safety awareness that are mandatory trainings for Ontario workplaces. So the next thing is supervisor competency. So OSHA requires employers to appoint competent persons. They define a competent person as someone who is qualified because of knowledge, training, and experience to organize the work and its performance. So also is familiar with the act and the regulations that apply to the work and has knowledge of any potential or actual health and safety or any actual danger to health and safety in the workplace. So just some stuff to keep in mind if anybody's in a supervisor role or supervisor capacity, this is some of the duties of the supervisor. So some other training requirements that are typical in Ontario workplaces. So WHMIS, first aid and CPR, violence and harassment, confined space entry, personal protective equipment, use and care, general duty to provide information instruction to safeguard workers, and operator competency. So operator competency can be anything from, a forklift to a scissor deck to pretty well anything that somebody would operate in a workplace. So some of the other standards that are referenced typically, so the CSA, Canadian Standards Association. So the ministry inspectors often use these to test reasonableness. So if they go into an operation and there's issues, they typically refer back to the CSA standards if there isn't specific guidelines around that training. And the CSA standards are very robust for most things. So they have all kinds of information when it comes to equipment training, such as forklifts. They've done a lot of work on battery electric vehicles as well. So technical standards and Safety Act, several enforceable regulations. So there are other sectors when different regulations for things such as elevated devices and propane storage and handling. So if we look at what training is, training defined by CSA is the occupational health and safety training, any structured activity with measurable outcomes provided to gain, improve, or retain a trainee's specified knowledge, skills, and abilities, or to influence attitude. Provides for continuous occupational health and safety improvements, work participation and development, assessment of needs, audit learning methodologies, content for workers, supervisors, joint health and safety committees, and worker health and safety representatives, training and differentiates between knowledge and skill. So in occupational health and safety, knowledge must be applied. So what is our approach and course and capacity? So our role, we've been around for a little over 35 years. We're designated by the Ontario government in the Ontario Health and Safety Act as the province's official occupational health and safety training center. We train workers, their representatives, supervisors, and employers in all workplaces, regardless of size, sector, location, or union status. So our mandate is broad to do training all across the province of Ontario. So some of our partners include organized labor, Indigenous First Nation organizations, and the Ministry of Labor, as well as many, many employers. So our participant-centered course design, so we start with the participant experience and we build on it. So we want experiences of hazards, controls, injuries, and illnesses. We add theories such as hierarchy of controls, hazard categories, and we practice applying the learning to their circumstances. So we really want participants to be engaged in their training and learn and be able to take it back to their workplaces. So we use various instruction techniques, actively involve participants in creating knowledge with examples in their workplaces. And we have ongoing checks to ensure learning is happening. So range of evaluation techniques, we have demonstrations of skill and knowledge, and we apply it to the circumstances and experience. So we really want to make sure before we get to an evaluation at the end that everybody is picking up the information and learning as they go along. We typically say if the final test of the evaluation, it's already too late because they haven't retained that knowledge. So we have an extensive training catalog. We have over 200 programs that are ready to deliver for workers, equipment operators, joint health and safety reps, supervisors. So, and we say your students. By saying this, I mean anybody that's wanting to take a training program. And we always meet and exceed general duties and specific requirements to help safeguard worker health and safety. And we always try to make sure that we have updated training to ensure that we're capturing the emerging hazards in different workplaces. Stuff like indoor air, infectious disease, biological hazards, emergency and pandemic planning was a huge one. We do have a couple mental health programs as well, psychosocial hazards, and also workplace violence and harassment, which seem to be pretty prevalent in lots of workplaces these days. So we also have training for long-standing issues, anything from vehicle driving hazards, fire and explosion, noise, witness, hours of work. So we have all kinds of different programs for different hazards that have been long-standing issues. So we have different training for sectoral concerns. So depending on the industry, we have specialized training based on the needs for that sector as well. So we do have stuff for construction, healthcare, mining, industrial, manufacturing, education, office and professional, and hospitality as well. So we try to supplement all those areas. And then as far as trades go, we have many, many programs for different trades to make sure that we can help support all the trades as well. So here's just a little snapshot of some of the programs that are available for some of the trades. And then we also have training for equipment operators, anything from forklift to rough terrain, skid steer. We also offer suspended access, equipment installer and operator training. So there's a whole suite of stuff for operators as well. As far as healthcare goes, once again, we have a whole suite of stuff like that. A lot of that we kind of capture in Joint Health and Safety Committee training. So for certification part 2, we want to make sure we're specific to each sector when we do the training. So we'll typically pull certain modules from each sector when it's sector specific. So here's just an example of some of the stuff that's available for healthcare. Also, we've been doing, we got a grant last year to do a bunch of translations. So we have a whole suite of French language programs as well, which is fantastic. That's one of the areas we were lacking. So a large portion of our programs are now available in French because there is a lot of French-speaking people all across the province, and we felt like we weren't supporting them enough. So now we're hoping that this will help out with that. We've also been approved to do first aid and CPR training as well, which is a first, I believe, for the organizations that are here today. So we are now offering first aid and CPR training for all different aspects, standard first aid for adults, for children. We have specialized first aid programs as well for wildlife and stuff like that as well. So we have 14 different types of first aid programs that are available. So some benefits of partnership. So there's a few ways to get in touch with us. You can register online for public courses. You can call a training service representative for an on-site course, and we can provide service agreement price, time and materials, but a little bit more on partnership. So if you work with us, it's a seamless process. We can give you more information on the courses, the descriptions. So we have highly qualified instructors supported by detailed session plans. And what we try to do is we try to match our instructors based on the need of the client. So if it's somebody in, let's say, I'll say mining, that's my background. If it's somebody in the mining industry, we try to get somebody, one of our instructors with experience in the mining industry to go in and support them with those programs. They're better be able to answer those questions that come up throughout the training. So we provide comprehensive participant materials, any of the required equipment to complete the training, and we always provide a record of training. And if ever required, we'll replace the training card if it's lost or damaged. So we have a few different options for training. We have instructor-led, participant-focused training. We engage in-person or virtual classrooms when appropriate only. So we can't do a virtual program for an operator-specific program. Obviously, we can't do a program where you would have to demonstrate proficiency on operating a piece of equipment virtually. Another program would be, working at heights. We do that in person, and there's a demonstration at the end where you have to demonstrate proficiency that you've learned how to safely attach and stuff like that. So our instructors, it's a considerable roster, combined training and work experience. So I've mentioned that already. And they really focus on adult education methodologies so that everybody retains the information when they leave the training, they're ready to apply it in their workplace. And then something we've been doing lately, we've been co-branding materials for some of our partners. So if that's something of interest, that's something we're able to do also. And then participant aftercare. So our commitment to all training participants doesn't end when the classroom empties. We also support with free inquiry services, timely and relevant publications, and extensive online resources. We also offer e-bulletins from time to time about emerging hazards. And then, so like everyone else here, we're a nonprofit, so this allows us to have affordable pricing. And we offer deep discounts for members or partner organizations with sufficient quantities are ordered. So if anybody's interested in becoming a partner, we can walk you through that process, and there are some discounts available for you. So how we can help, so we can prepare students for the current workforce demands in all sectors. We can meet and exceed legislative training requirements and industry standards. We can promote workplace health and safety and protect vulnerable new workers. We can provide comprehensive, seamless service for all training courses at an affordable price. And then here's just a link to our website that'll give you a training service representative in your area. If it's in the Sudbury area, it'd be myself, but there's a link there if you're from a different area that we can help support you to get in touch with the right person for your area. So, and that's it for me. Thank you, everyone.
This actually brings us to our first break. So everyone can walk around, stretch your legs. I think that's what we've got. We're going to take about 10 minutes. So 9:43, 9:44, that works for everyone.
please unmute.
No, I couldn't. I was still on today. Which reflects in.
We just have to
We're gonna go ahead and get started. So welcome back from break. I'm Deborah from IHSA and I manage the operations for the north and east. So I manage from Ottawa and down the 401 corridor and then into Bowmanville and then Sudbury, Timmins and kind of all of that area to the east out to the Ottawa, Quebec border. For the staff or the participants rather who are online, can you just confirm with Kate in the chat? We're good? Okay, perfect. We were unsure about the owl situation, so we're good. Perfect. So just like the other system partners that were speaking with you earlier today, I'm here to highlight some of the services that IHSA provides. We're lucky enough to also have 2 local staff members in the room with us, so I'll introduce you to them as well if you don't know them, and discuss how we can support you, and then lots of really great resources to help you at the back of the room as well. So make sure you pick some of that up before you go, okay? So just quickly, again, what I want to talk about is what we are, who we are, the services that we can provide to you. And I also want to spend some time focusing in on free resources. I kind of feel like free is a really good word. So highlight the free services that we provide. I'll show you where you can access that information. And when I say services, I'm not just talking consulting. I'm also talking about different applications that we have on virtual platforms that you can engage with and resources that you can watch and review at your own pace as well. So there's quite a few different varieties of things that we offer there. Okay. So we are, just like the other associations in the room, Ontario's Trusted Health and Resources for the industries that we service. And I'll get into that in a little bit. Our goal and priority here is really to improve the lives of Ontario workers. So what we want to do is we want to make sure that everybody gets home at the end of the day in the same condition that you left in the morning. Home to your kids, home to your other family members, your pets, your friends. We all deserve to go home the same way we left and said goodbye in the morning. The unfortunate reality is that's not the case for everyone every day. So we really want to do our part on the prevention side of the system to give you the tools that you need, the resources you need, the education that you need to help identify hazards, and preferably if you've taken a course with us or probably any system partner, eliminate the hazard is the preferred method, right? So that's the goal. So when I talk about IHSA and the members we service, I just kind of want to get a feel for the room here. Who knows about IHSA and can tell me a sector we service besides the IHSA staff? They're not allowed to answer in this case, right? So what does IHSA do? Tell me. Throw something out. Construction, absolutely. So we do service construction. Who else do we service? John, yes. Who else do we service?
Electrical utilities.
Electrical utilities is a main component of what we do. Anything else?
Transportation.
We do service transportation, absolutely. So, we talked earlier about NAICS codes. So that's how we divide up what Safe Work Association is going to service which members. And then we tailor our staff to be specialists in those areas. So when we talk about IHSA, who does IHSA service? So aggregates, we do service the aggregate industry. Lindsay, you had alluded to this very nicely in your presentation as well. We cover ready mixed concrete and natural gas, as well as the three that have been mentioned in the class with the construction, electrical, and transportation industry. So this is our area of expertise. We're going to get into training as well, but the individuals that you engage with on the IHSA side of the systems umbrella are specialists in these areas. So we're going to pair you with a subject matter expert who's actually has the hands-on experience in what they're teaching you or in what they're consulting with you. So you've got someone who's been in that situation before. That's an example. So who we are. So we have a variety of consultants that cover the province. Please understand, I'm just focusing on my team right now in the Sudbury kind of Timmins area. So the first one I want to mention is Carrie Rady. She's at the back. Hi, Carrie. There you go. There's Carrie. So if you don't know Carrie, she'll be available after as well to answer questions at our table at the back. But she's got quite a bit of construction experience. You can see here, general construction, heavy civil. She's one of our hoisting and rigging specialists. She's an expert in traffic control and signaler programs and a whole bunch of other things. So Carrie's based in Sudbury, but she does cover the surrounding area as well, similar to what I have for Holly. So Holly's here as well. Hi, Holly. Yeah, so they get shout outs. Very fortunate to have both of these ladies on the team. Holly comes to us also with a construction background, but you'll see here she's also got some surface mining, some transportation experience. She helps to cover this immediate area down into Hearst, Bracebridge, North Bay. So these are the two individuals that if you're looking for training or consulting, you're likely to engage with in this immediate area. Outside of this geographic region into the Timmins area, we're fortunate to have Karen. So she's based in Timmins. She covers Kapuskasing for us, New Liskeard, Hearst, and all the areas in between. And she's construction background. She's got commercial, residential, heavy civil as well. So we do have different experts across the region that kind of travel throughout. They're a bit fluid in that way to support the members we service. So I broke this out into two buckets as to how IHSA can help service you. The first being training. And then the secondary component that I want to chat about is the consulting bucket of our services. So when we look at training, one thing to note, we do offer programs in the classroom. So just kind of like I'm speaking with you right now. We offer virtual, online instructor live, as well as e-learning. And we have the ability to do training at our office locations. We have an office in Sudbury, we have an office in Timmins, or to come to your location to provide training as well. So there's a variety of ways that you can engage with us on the training platform. I did break this out a little bit into some of the sectors we service, just so you can get a flavor of kind of at a high level what we offer per sector. So when we look into our aggregate examples, so Malcolm, you had mentioned JCERT Part 1 and Part 2. We have the aggregates program for Part 2, which is available to you. We do have the Surface Miner Common Core program that we can offer for aggregates business, as well as basics of silica, air brake, load interrupter maintenance for heavy equipment, heavy trucks in the environment as well. Taking a look at construction. So you'll see on my slide, I don't know if it has a pointer, but where it says aligns with current ministry compliance campaign, that's there to acknowledge that. So the ministry's campaign is focused primarily right now on residential construction, but they've been doing a lot of site visits surrounding working at heights, struck-bys, trenching falls into there. So that's highlighted on the slide as we have this training that can proactively support you in the work environment, help prepare for a ministry visit, hopefully help prevent an incident or a near miss. So anytime you see aligns with current ministry campaigns, we're just trying to align, this is what they're looking for, and here's what we have to proactively support. That's why that's there. Okay. But obviously our Working at Heights, CPO approved, Working at Heights refresher. We also have the confined space entry and awareness. So we offer both of those programs. Trenching, hoisting and rigging, propane, When it gets into transportation, so we do have a variety of transportation programs. I just picked the very common ones here with the defensive driving, transportation of dangerous goods. Electrical, so we do have another division within operations that focuses on electrical utilities. And they cover the province. They're separate to the team that I work with. But here, so part 1 certification, ground proficiency, pole climbing, you can see electrical safety awareness. So they're all specialists in these programs. Do obviously a lot of work with hydro companies, but also other firms as well. So electrical profile here. And then we do also have some cross-pollination, as Lindsay had mentioned. So for us, when we look at who do we service and what programs can kind of go to any sector, there are a bunch of them that would be applicable. So if you look, the Working at Heights, our lift truck, forklift program, trenching, traffic control and signaler, I do want to touch on for a minute. So Sudbury has a lot of road work happening. So and every time I come here, I realize there's a lot of road work going on. So on my journey to the hotel and here, quite a bit of road work. Just a note on traffic control temporary work zones. So MTO Book 7 was last updated in 2022. It's one of the programs that I think we offer, which can cause some confusion when you're trying to flip between the different tables and the different parameters for your typical layout. So if you haven't taken that one in a while, I'm just going to suggest it might be a good idea to take a look just to get to know the new Book 7. But that traffic control temporary work zones is how do you set up a typical layout? How do you set your closures? Where does your traffic control person need to be? Do you need a longitudinal buffer area? Like there's a whole bunch of different components to consider there. Whereas signaler and traffic control person is where am I positioned, but how do I communicate with operators? And where do I stand relative to different hand signal techniques, things like that. Okay. So they're 2 different programs. Just a little bit on supervisor and health and safety representative. So these are 2 individuals that we try to focus on and work with quite a bit, especially if we're in a consulting environment and on a project site. So as it relates to the role of a supervisor or health and safety rep, keep in mind that's different than committee member, right? So a single representative or a committee. There is some training that we recommend that you take. So the basics of supervising, I will say it's a free program to members. It's 2 days free if you do it at the IHSA facility. And it's a really good program. It walks you through legislative requirements, what due diligence means, how to meet the test of due diligence should you ever have to. The communications skills for supervising health and safety is basically, I'm going to describe it as the next level up. So it gets more into the legislation, but also communication techniques and the importance of safety talks, documenting and conducting interviews should an incident occur. And then we have our Intro to Hazard and Risk Management, which provides different tools and ways to analyze hazards on a job site. I'm not saying there's one way that fits everybody because there's not, but it really gets into the importance of making sure that what your staff are doing on site is effective and efficient. And we're meeting the target of safe production, not safety versus production. Okay. And then I will just say last but not least, we talked about the CERT, but investigating and reporting incidents. So what needs to be reported to who by when, and what does that look like, and how do you do an investigation on an incident? When we get into consulting, these are things that the staff can assist with on a job site with hazard assessments and things like that to support you. But I do want to highlight that even though this slide is for supervisors and representatives, if you're hiring subcontractors, it's important that they have the training too. So don't forget about them. One of the things that we're doing in the North in particular right now is trying to get on sites with our big partners in areas to work with their subcontractors and to offer services to them, because we don't want to forget about the new contractors, the smaller contractors that are supporting the bigger players in the industry as well. With respect to consulting, so this is my other bucket, if you will. as I said, the staff can come to site. We do go to site. It's something we've been doing a lot more throughout the past 2 years, I'd say, 2 years. So they're available to help you with inspections, to conduct a gap analysis to what they're seeing on site versus legislative requirements, as an example. They can do safety talks. We've been on site to talk about different topics with different trades and do safety presentations. The safety presentations we won't offer a cert for because it's not a canned IHSA program, but the staff are available if you wanted a safety talk on, let's say, EWPs. We can come out, do a safety talk, do a presentation, do a site inspection, show you how to do a proper inspection on that equipment, and what to look for. So different things that we can assist with, and I would encourage you to reach out to the staff to have them come out because it's all about being proactive. We're not calling the administrator to report you after and report all of our findings. We're there to help you and support you so that you're not in a situation where a worker's injured. It's a new set of eyes. Think of it that way. It's a new set of eyes to help you identify things that could go wrong before they do. Okay. As it relates to resources, so a couple things here, and I'll get you guys to, Anna, are you doing it? I'll get you to pull up the website in just a minute. But these are some of the products that I wanted to show you that we have for free. I will let you know that we announced yesterday that all of our e-learning is free to the end of the year. Any course content. There's a promo code that went out in our 2-minute news. You can use that. We'll issue a certificate. So take a look at our e-learning. Use it, it's free. Take advantage of it. The goal is to help give the education push to the end of the year. Obviously, the goal is beyond, but to get everybody to meet targets and to help educate workers and supervisors in the field. So some things here to talk about. Tiana, if you could pull up the website, that'd be great. So this links to our website. This is a new platform that we have. And this is where you'll find all the free resources that IHSA offers. So safety talks, you can search by topic. We also have, Kara, do you mind just holding up the MO29? I apologize. At the back, which is our best resource. This one here is broken out by topic. You can use the information in there for safety talk or for resources internally for education for staff. We have videos and webinars. We're up to right now 119 podcasts that you can listen to for free. Everything from asbestos to Holly did one for us on nutrition. We had Adam in the East do one on building your health and safety system, driving hazards. It's all there. Search by topic. It's a free resource. Sorry? Oh, yes, safety talk manual.
If you don't want to get it online, we did bring copies of the safety talk manual if you'd like to do it.
Perfect. Yeah. Our magazine and 2-minute news is free. You can subscribe online. We'll issue legislative updates, industry updates, so that you're up to date with current happenings in the industry. You can just go down just one more time for me, Tiana. And then the training, this one here I do want to chat about, the training awareness chart. This breaks out different hazards that you're doing and highlights you to legislative training requirements. So it's all right there. Please take advantage of it. It's there for you to use. We're here to support you. You can scroll down, it's in there. But really, here you go, right? So compressed air needs to be trained. What's the legislation? What training do I need? Right by hazard, right by topic. All I need you to do is highlight it. Sign up for training. There's one other thing I do want to spend just a bit of time on here, and this is our See Something, Say Something campaign. This is not geared only to IHSA. I want to spend some time chatting with you about this in its totality. And we do have the poster at the back, got copies. We do have stickers of this. So I said at the beginning that the goal really is to make sure that workers get home safely at the end of the day in the same condition when they left. This campaign stems from some of the work that a coworker of mine, Jen McKenzie, has done with the coroner and fatalities. And some of the families that we've had the unfortunate pleasure of working with as a result of fatalities that they've gone through as a family. And one of the ones I do want to talk to you about was an individual named Dean McGuire. And you can, if you go to our Keep Your Promise page, you can see the full story. But the message is, Dean was working, doing sheet metal work, about 12 feet up. He didn't have anywhere to tie off to. So he tied off his SRL, the self-retractor, to a vertical column. That self-retractor fell and engaged the buckle. And when it engaged, it pulled him off. Throughout the court process and some of the interviews that came out, it was found that at least one person knew that where he tied off wasn't safe. But nobody said it. Because there's still this, I don't know, I'm gonna call it a fear, it might not be the right word, of ratting out someone else from a different trade. And we need to, and I'm talking to you very personally, we need to get away from that. This campaign is not about ratting out a coworker or ratting out someone from another trade. It's about asking the question. Because if I'm working unsafe, or maybe I am working safe, and Carrie's on site, but she doesn't know. So she stops me to ask a question. And let's just say Carrie stops my work production to ask me a question about my process. Turns out she's wrong. I was doing this safe. What's the worst thing that just happened? What is the absolute worst thing that just happened in this scenario by Carrie asking me a question and getting me to clarify my process? Nothing. Nothing. Nothing happened. I stopped for a few minutes. You know, we talked about it. Maybe Carrie didn't know. Now she knows. We looked at things, we double checked. You know what? Things are safe. Let's keep going. But what if she's right? What if she's right and I didn't catch it because I've been working on this site for 6 months, 10 months, a year, 2 years, however long, and hazards become background noise. I've been there. I've made the mistakes. Guilty. But what if she's right and she doesn't say anything because she's scared to speak up, she's unsure, she's not sure how I'm going to react? And that's what this campaign is about. We're trying to encourage people, if you see something that you think is unsafe, say something. Because in my example, the worst thing that just happened is Carrie stopped me and I took a couple minutes to explain to her why I'm doing this properly. Or we double checked my system, or my shoring, or my trench box, or my spoil pile distance. That's the worst thing to happen. But by doing that, she's helping make sure that I get home at the end of the day. So see something, say something, hits hard. Because there's a lot of families that are impacted by loss and illness in the workplace. So my encouragement to all of you is to please speak up. If you're unsure, please speak up. It's better to be wrong than to not say anything and be right. Okay, so the posters are at the back. Please consider spreading this to your workers, to the workforce. Again, this is not just an IHSA promo. This is a Health and Safety Ontario and beyond request that I'm bringing to you now. Okay.
You have the stickers too.
We do have the stickers, yeah. I'll save questions to the end or to the back afterwards, but I wanted to thank you for being here. It means a lot to us that you're coming out to notify us, and hopefully we can work with you to create a safer Ontario law enforcement.
Go straight to WSPS.
Morning, everybody. Another session of us health and safety folks up here. So good morning. Thanks again for having us. Another piece of the, I won't say coin, but six-sided dice here, if you will. One of the many pieces of the Ontario health and safety system. We are Workplace Safety and Prevention Services, the blue team, if you will. And I want to give you my name is Aidan Robertson. I'm a senior health and safety consultant with WSPS, based out of the Sudbury area here. My colleague Jesse Campbell here, also based out of Sudbury. Manager Pam back here. So we form kind of the core of our, we call it our Sudbury pod, one of our Northern Ontario pods. We have staff all over the province, many different locations down south. We have teams in Sault Ste. Marie, Thunder Bay. You name it, we'll go there. We'll help people who need it. Who are we? We are one of, again, of the sector-specific health and safety associations. So we serve primarily, we have over 174,000 member firms and around 4.2 million workers. That would fall within industry sectors that would be within our mandate. We offer a wide range of compliance with both federal and primarily provincial health and safety regulations, and a wide range, much like many others, of consulting, training, guidance, and various resources. Like I said before, wide range of people, many similar services to those that you've heard from others in the room here again. So depending on what sector you're in, I can come to one or many of us. A lot of times we bounce ideas off of each other. Again, given our very vast experience, our various experience in the different types of work that is done. I thought, Lindsay, you framed it really well there of, yeah, there's different stuff that goes on inside any, one industry specific type scenario. So again, we can help with health and safety management systems, policies, procedures. We do have a lot of specialized personnel as well. So really getting into the technical health and safety services, things like confined space hazard assessments, warehousing and racking, machine safety and robotics. We have robotics experts on staff to help with things like your interlocking and guarding solutions to many of those relevant CSA standards and other standards that were referenced earlier. Mental harm prevention, one of the things. Team of occupational hygienists, well equipped to provide these services across the province, ergonomists as well. And some things that aren't noticed on here, some unique services that we're getting into. One of the things I like to promote up here in the north is that we will provide things like hand, arm, and whole body vibration assessments. I know OCAW speaking earlier about some of those informational resources that were put out. Again, we're one of the partners with WSN, OCAW, all of them and the ministry with regards to hand, arm vibration initiative that's going to be firing up here this fall. So we want to see people successful with that. And again, much like the others, again, it says 4 health and safety, 4 sector-specific associations here. So again, obviously many more than that. We're all here together in the room. But that's where our expertise primarily lies, is within the manufacturing, agriculture, and warehousing sectors. Again, go for a drive down south. As soon as you hit there, you start to see those flat top buildings that store things in them and that get stored there, shipped out, made there. Those are all places that we by and large support that do create that large workforce of around 174,000 member firms. And like we said, 4.2 million workers. And again, we get our support, much like many others, from the WSIB, from the Ministry of Labor. I somewhat jokingly say sometimes to try and make light work for those other players in the system. Again, like Lindsay said, if we help people do their job right in the same philosophy as defensive driving school, then you shouldn't have to receive those tickets, fines, charges, or deal with those unfortunate incidents when they do occur. So again, didn't want to belabor who we are a little bit. I want to pass over to Jessie. She's going to give you a bit of an overview about all the sorts of exciting stuff that we can offer to a range of small businesses and some of the initiatives that we've got going on up here in the province.
Awesome. Thanks, Aiden. So as Aiden mentioned, we do a lot with small businesses across Ontario. And so we have a small business center that is housed out of our WSPS.ca website. And in there you will find a lot of free resources, one of them being a safety roadmap. And it's broken down into the number, your size of business. So whether you're 1 to 5, 6 to 19, or 20 plus, the roadmap will guide you through the requirements and resources that you need based on the number of staff that you have. We also have a small business team, which includes small business account representatives. So that offers one-on-one coaching and support. So if you are a small business owner and you need a little bit more guidance, then they have a team of representatives to help walk you through that. And then we also have the small business advisory service. So that is for businesses with under 20 employees. And that will pair you up with one of our WSPS volunteers. And it gives you 10 hours of consulting from that person. So it's almost a mentor to help guide you through as well. And then we also have something called the Downtown Health and Safety Days. Not downtown specific, but if you have a small business or a business in a strip mall or within a mall, an industrial area, we can come and do an event where we pick a topic, maybe relevant to your workplace hazards, have a discussion about it, and release some information across those businesses. So now I'm going to move on to our health and safety assessment to identify OHS gaps. And you'll see it says prepaid consulting, another word for free. So this is a free resource. So this health and safety assessment offering has been developed to leverage expertise in OHS legislative compliance and support under-resourced Ontario businesses. So the way this works is you would work with someone like myself, an account manager, potentially a consultant with WSPS. And we have a tool called the Customer Assessment Tool, and we'll walk you through a series of questions, yes or no answers, to determine where your gaps are in compliance. From there, based on your answers, it's going to generate a report that also provides you resources. So if there's something that you are not compliant in, the report will give you a link to a resource that you can then use to become compliant. And of course, the account manager or consultant that you're working with is there to walk through that with you. So some of the things the compliance assessment looks for is duties and responsibilities, posting requirements, health and safety policy program, violence and harassment policy program, risk assessment, joint health and safety inspections, training and orientation, injury reporting and investigation, first aid, naloxone, and return to work. So again, work through it with someone by your side and then obtain the resources in the end to hopefully get you to that compliance level. And it's free. So another current prepaid free consulting service we have is a material handling assessment. So this would be an on-site visit by someone like myself or Aiden to provide direct one-on-one support with material handling hazards or risks. So again, going through a checklist, doing an on-site walkthrough, determining where you're receiving your shipments, where you're unloading those shipments, how are they being moved, how are they being stored on shelving. And again, at the end of that walkthrough, you are provided with resources to help you mitigate those risks that we've identified during your walkthrough. While we're there to, walk through to look at material handling, again, it can be an opportunity to look at other things as well and provide the resources for that. Another thing to note is that these resources do come in 5 different languages. So really trying to gear it towards the languages that are being spoken within the workplace to ensure everyone is understanding those hazards. And something that we've recently partnered with the ministry on that is really exciting is we are now supporting with orders or narratives that are left by the ministry. So when they go into a business and identify that something is not in compliance or that there's an opportunity for improvement, then we're working one-on-one with those businesses and offering 1 day of complimentary on-site consulting. So based on what the orders or the narrative has been, we then go in, have that conversation with the employer and provide the resources to help bring them into compliance. So whether they're missing a policy or a procedure, we have something on our back end that we call building blocks. And those are policies and procedures that we help to customize to suit your workplace to bring you up to compliance. We have a wide variety of building blocks. I think there's over 35 of them at this point. But we're seeing a lot of things in regards to violence and harassment, or businesses not having violence and harassment policies, or not having their safety board meet the requirements. So again, all those resources provided to you for free, as well as the one-on-one support from, someone like myself or Aiden, depending on what area of Ontario you're in, completely across.
Can I say one thing on that?
Yeah.
It's been really interesting supporting some of these orders and some of the unique ones. A company gets an order for saying, hey, you have to handle this hazard because something reasonable hasn't been being done. We've had a couple recently with respects to, the discovery of illicit drugs in or about a workplace frequented by patrons or members of the public, picture like an arcade, bowling alley, that type of business. So we're saying, okay, that's not, obviously that person or those people didn't get into that business to, with that expectation that that's something they'd have to do. That's not their skill set. So that's where we can come in and say, hey, we have that knowledge, that know-how. We can help you put together a procedure. We can help you, orient your people to it and do a bit more of that customized type of policy, safe work development that's needed for those specific circumstances. Because we've seen examples where by the time that an order gets to us, a company or a client has tried to comply maybe once or twice, and the ministry come back and say, well, it's not checking all the boxes. You've said maybe something's been printed off the internet at face value, unadjusted. If they're saying that you're going to follow that, but you don't have, for example, supplies within that procedure to carry it out, well, then that order is going to remain open. So we're finding a lot of value in bringing that professional health and safety lens to show that work that's being done as well. Make it so that the workplace can come back and so say with confidence that they know what they're doing with respect to that order.
And as Aiden mentioned, we have a lot of expertise across our teams. So there's always someone that can be pulled in to support regardless of what the order and the narrative is. And for those of you in the room, so when we finish and you come back to the booth, we have a small business orientation handbook, and I do believe Brittany will send out links for resources after. So this is a great tool if you're just starting out. It's free. It's like a PDF. You fill it in, you put your information, you review and download it, and it gives you an employee orientation handbook. So I recommend definitely checking that out. And then similar to our other association partners, we also have a podcast, Safety Bites, e-news, small business videos, resources that are free on the website as well, that support certain topics or high risks that we're seeing within industry. And finally, WSPS is a WSIB Health and Safety Excellence Program provider. So we have a dedicated team that focuses solely on the Excellence Program and supporting those members that join. There is I believe $1,000 incentive still for registration. It changes quite often, but you can go through the WSIB website and see what other providers are available, see what your best fit is, and then you go through the program, and if you sign up with us, you are assigned a excellence guide, and that person will help you pick your topics, go through the topics, make sure you're ready for validation. So we focus on that really, one-to-one help and resource for that. And similar to the others, our goal is to have people return home in the way they left in the morning, return to their families, and enjoy retirement as well. And if anyone has any questions, Eden and I will be up the back. But I definitely recommend also checking out on WSPS.ca for our free resources.
Flying through. So we're on to break 2. So we're going to take 15 minutes this time, maybe 10:40. That's good for everybody. Thanks. Thanks, everyone. We're on the home stretch now. So I'll pass it on to Sandra.
Home stretch.
Home stretch.
I'm amused here because I think like we're super on time. We're way ahead of schedule, right? And so I'm an academic, and anybody who's met academics know that we talk a lot. So I'm real interested to see if I too will be ahead of schedule. You'll be like, wrap it up, Dorman. So I'm 10:42 when I start. I'm really glad to be here today. Oh geez, I feel like it's been about 3 years since like Prosh, WSN, and OPAL, I think, originally came together and were like, we really need to like meet more often to drive our northern specific needs, if you will. And then after we did that, I think for about a year, we were like, wow, like isn't it everybody in the group, right? And so we all have a lot to offer. And I think it's terrific when we can leverage the different pieces that we're working on with support with each of the organizations so we all move forward. And let's be honest, I think that's part of the strategic priorities of the ministry as well. And so we also get to show how we're working together to get stuff done and save them money, right? So I am, if you don't know me, I should have started with that. I'm Sandra Dorman. I have the pleasure to be the director of the Center for Research in Occupational Safety and Health. So we are one of the ministry recognized research centers in Ontario. We call ourselves CROSH for short because obviously that's a mouthful. And it makes lots of great little fun big acronyms, you know, like we're crossing it, or, you know, look both ways before you cross. Okay. I just made that one up on the spot. So our mission is we envision a Northern Ontario where workplaces partner to ensure every worker gets home safe and healthy every day and a long retirement. And our vision basically is to be an agent for innovation and discovery to solve relevant and critical problems facing Northern industries so we can eliminate occupational injury and diseases from their workplaces. And I like to talk about what we kind of call the Sudbury model. And so I've worked, probably the only organization I haven't worked a lot with is PSHSA. And we want to, I think that's changing. And what I wanted to do, if you haven't worked with us individually or you don't know about us, I wanted to tell you who we are, what we do, and how we do it. But also I want to give some examples of how we've worked with different groups so that we can find ways to work together. And it can be from the very simple to, like if I go into a Northern community, I'm happy to take your support materials with me, right? To much more complex, which will be, I'll show you some of the examples of that, okay? Talk a little bit about the Sudbury model. So as I said, we're not the only research center in Ontario, but we were the first research center that was developed to exist in Northern Ontario to specifically address Northern Ontario needs, right? And our whole model centers around this team. We love team. You know, the goal is to collaborate with the worker, with the workplace, also to collaborate with the Safe Work Associations, unions, and the industry partners to solve problems, because problems are incredibly complex and you need everybody at the table to solve them, basically. And so when we design our research approach, you'll kind of see on the next slide, the goal is always that the problem is coming from the worker or the workplace, and we're trying to understand it and then develop solutions with them and with all of you, right? We also, though, I'm based out of Laurentian University. Our mandate is also to increase training in occupational health and safety professionals. My hope is that every student that walks through our door walks out with some level of training. Not all of them are going to go on to be a health and safety specialist, although some of them do, but all of them hopefully goes on to have better protection or better advocacy in that space, if you will. Okay. There we go. Okay. Underlining that kind of concept,
we always, we see the worker as central to what we do. And so I kind of tried to say here, workers are more than assets for optimal health and safety. We rely on them to help us understand the complexity of the problem in the workplace. We know that they can identify novel approaches that can be effective solutions. Like, we don't have to go in there and be like, oh, let me put on my pointy hat and tell you how this should be fixed, right? They probably already have ideas on how it could be fixed that we could work with them to make happen. They can certainly drive innovation, and they also, going to the See It, Say It campaign, which I love. I'm getting their stickers. They can help educate other people, right? They are an important part of the whole safety pathway. So I alluded to this. This is our approach to research. We do what's called field to lab to field. And so you can kind of see a little bit here that we have infrastructure. Is there a point? No, I'm a walker and I'm loud. But you can see we have our mobile lab. The goal of that was to be able to get into northern communities. And because we want to, first and foremost, understand the problem in the context of the workplace, which often means we have to do some kind of field engagement to measure things or talk to workers, talk to management, et cetera, to understand the problem. And traditionally, workplaces in northern and remote communities don't have access to participate in this type of work. And so we raise funding to build a mobile lab to allow us to get there. So go to the workplace, understand the problem, probably collect some data about the problem, and then ideally we bring it back to the lab. In the lab, we design a study to try and get at, maybe further understanding the problem, maybe testing out a solution to the problem, because it can be very time consuming and expensive to try and test solutions in the field that can cost workplaces a lot of money. And so we try and, do as much as we can outside of the workplace in our lab. And again, we've raised quite a bit of money to build the infrastructure, support northern specific industry challenges like heat or cold, like vibration, like line of sight. We got a little picture here of a few of the tools that we have up and ready to sort of show you. This particular one, the worker has a VR headset on. We're measuring their physiological markers. They're being shaken like they were, using a particular piece of equipment, and they're in the environmental chamber, so potentially exposed to hot or cold. Okay. Oh, I missed the last field. So if we come up with a working solution, then ideally we need to take it back into the field to test it, because as you know, solutions that work in the lab may not work in the field. And we're trying to always partner with industries to do this as well. In fact, we've been doing a lot of stuff with wearable technology for heart rate or for heat stress or fatigue, because lots of companies are making things to solve problems, but they haven't been tested in the field. And I don't have to say it to you guys, right? But a workplace that takes something that's crap, or it's not even has to be crap, but it just doesn't work in the context, they won't try it twice, right? It's too expensive and time consuming. And so they need to partner with organizations to test it out before they put it into the field. But that is kind of what we do. And then sometimes it doesn't work in the field. And then we have to go back to the lab and test it again and kind of do a circular answer. Research is slow. Okay, so going back to kind of this context of the Sudbury model. Sudbury, as you know, is a niche community that's fairly large, that does, is a hub for a lot of the northern industries that kind of represent Northern Ontario and other communities around the world. So I will say probably about 80% of the research that we do either occurs directly with partners in Sudbury or Northeastern Ontario more predominantly, partly because Evident Work opened in Northwestern Ontario a few years ago, so we try not to step on toes either. But I always like to remind people that just because the work is happening here, the applications are still global. And I think you'll see that with some of our examples. Okay, so here's a couple of examples of projects that we've done recently. I tried to get a little bit of breadth here, but the first one, we partnered with OCAL to do. We took information that we had been learning from our research studies with wearable tech, and we helped create the heat stress toolkit. If you guys haven't seen the heat stress toolkit, I like it. But yeah, that was, you know, and the way we fit in this pool is our ideal is to test out, you know, research solutions and keep up with our best practices, evidence-based practices, but we don't want to train. We want to hand it off to the trainers, right? And so, and then we want to move on with the next fun experiment, right? So this was a really good example of that, where, I mean, we're still continuing to do heat stress work, and probably the knowledge translation that comes out of that will continue to evolve as we understand wearable tech in that space. But again, I don't want to be doing, you know, so much webinars on heat stress symptoms and whatnot. I want to hand that off. We also, we have an international expert in vibration space, Dr. Katie Goggins. She does tons of stuff around vibration, and she certainly, actually, if I can see, this is where I'm going to take 30 minutes. Sure. Katie's got a project right now where we're trying to enhance education about risks of both hand-arm vibration and foot transmitted vibration, also with education around whole body vibration. And we are trying to collect data on exposure levels in workers across Northern Ontario. So we are bringing the mobile lab to workplaces to provide a free educational, as well as to take some clinical measures that they can have as an individual. Because a lot, as you know, we see this, like I go into the field for heat stress, and young workers are telling me about their early symptoms around halves, and I am disturbed and sad because typically people don't really go get help until they're much more severe, right? That's why I think the blitz is happening and is so critical. So we want to understand what's happening in Northern Ontario, like in terms of collecting data. We partnered with Creod to, like where they do the hands research out of St. Mary's. We partnered with them to share the database that we get out of this. But we also want to, as they come in, we get the measurements, we want to educate them and give them tools. And so people can also start coming to our lab to take those measures as well. So if you're talking to people and you're involved in the blitz, please tell them that we're doing this, and we'd love to participate in any way to support Europe. Thanks. Tangent. This is an example of a project that we've been doing for the last couple of years with Timmins and now City of Sudbury. You see these little sidewalk cleaners. Apparently in Timmins, they're like #1 cause of injury for the city. And that's a big problem across all the, so when Timmins first asked us to do this, and they were great. They were like, we'll share our findings with the other cities in Northern Ontario because we can all benefit from this, right? But we're trying to help them measure both the vibration the workers are exposed to, but also identify different ways to manage the work to reduce that injury. Which, I mean, this is not my study, so I don't want to go too far down a rabbit hole here, but I know they're looking at things like where, what are the dangerous routes, identifying routes that have certain risks. They're looking at different ways of bringing the operator and the equipment to starting and stopping. I mean, obviously speed's going to come into there, other things. And then the last example I threw up there is one that I tried to pick one that was not local. We also partnered with Torex Gold out of Mexico to test the smart cap fatigue monitoring. And it was a terrific study. Helped them decide whether or not they wanted to implement a fatigue monitoring system. But we still have the technology to play with in the lab. So, I mean, I guess that also gives you example that we do research in lots of ways. We do research where we partner with ministry, let's say, to tackle a problem and recruit workplaces to work with us. Probably more often than not, though, we partner directly with a workplace to solve a problem that they're interested in. But we also will like contract out for work. And that can be in two ways too. So if you're like, say, a small business and you want to solve a problem, but you can't fund it, we can help you find ways to fund it. But in that scenario, those results will always become public, right? But you could also, if you're a company that has money to fund it and you just want us to give you the results just to you, we can do that too. Because we are publicly funded, but we also try to become sustainable. So we do contracts. Okay, so I talked about the infrastructure. I don't think I'll say too much more here. The purpose of this slide was just to say, I mean, we've been a research center since 2008. We opened our workplace simulator lab, I think in 2018, and our mobile lab was launched a little bit before that. So we built the infrastructure to do the work. I mean, if anything, we're understaffed to do all of the stuff that we want to do. That's all of you. Okay, so our three main roles, we want to drive OHS research at Laurentian. We want to provide service, you know, as I described earlier, with everybody. We want to train students. And so then the last part I just wanted to go through was try and also give more examples of the way we partnered with the different safe work associations and groups. So I do want to let people know that, you know, I said about solving relevant health and safety problems in partnerships already, but I want you to be aware that we do these four things. So certainly we can conduct the research. So if something is not understood, and this can be as simple as a literature review. We've worked with groups to do a literature review to give you a synopsis of what the current research is saying. But it certainly can be more extensive, right? I mean, research is all big. And attached to that is we can help with the funding, right? So, I mean, I do think we have a pamphlet about the different ways that we can try and help businesses or joint occupational health and safety groups best utilize funding they do have. Like, I mean, my tax is a good example. They'll usually give you like 2/3 of any money that you have. That's how the city of Sudbury and Timmins funded all of that stuff. Honestly, they could come up with $10,000 and we could come up with $30,000, and that was enough to run with it. So we can help find funding. That is what, like, we do that. We also offer paid student placement. So I always say I'm aiming for at least 15. I'm trying to get more money for this actually. It's very popular. I usually place more than 15 students a year. We pay the students $3,000 to do 150 hours of work with the workplace, so long as it's on occupational health and safety. And some of the safe work associations have taken advantage of that too, because my goal is to get a student who gets occupational health and safety training, right? I want them exposed to a JOSH. I want them exposed to committees and discussions about like, what are the real problems in the workplace? And so as a SWA, if you wanted to like work with a student, example, there was tons during COVID, it was like, all these changes required around COVID policies. Bring in a nurse. They'll give you 150 hours to help you develop your COVID policy, right? So there's opportunities with that. We also offer worker and workplace training. So I say we're not a training institute and we're not, but we do, especially, I'm going to call it more cutting edge stuff, where we're trying to push the bar. We will go in and give specific webinars, often upon request, often attached to a research project. So like the vibration stuff that Katie's doing will attach on a vibration and educational upon request for various groups or whatnot. So it's not what you guys do. But I mean, attached to that, honestly, we do tons of webinars and conference presentations for the various safe work associations across Canada, right? And that is one of the ways that we've regularly partnered with almost all of you, is to, if you need a lecture on X, we find an expert in And then the knowledge transfer exchange materials, I think that will come up with some examples. We've done tons of different stuff. We did develop a toolkit, let's say around line of sight that businesses could take. We tried to actually run this through a safe work association, and it didn't work out. But that's not my ideal, where we could develop a new package for you on safety training and give it to you. And maybe we get a small percentage back so we could fund the next package on safety training that we could give to you again. So I've cherry picked a few here. The heat stress toolkit I've already talked about, but I think it's a nice one, partly because it was a really good partnership, I think. But also, like, you know, we helped with the videos, right? We helped with the translation into French, I think Spanish too, honestly. We helped write the 3 guides, and we also helped develop a number of the infographics, right? So, yeah, I'd like to do that with everybody. This, like just last week actually, Dr. Goggins met with all the ergonomists across Ontario to give a 2-day training on how to measure vibration in lead up to the Blitz, right, in November. So she did hand arm vibration, foot transmitted, whole body, both in class learnings as well as laboratory, like placement of accelerometers and whatnot. This middle one, I've been working forever with the Ministry of Natural Resources and Forestry to help maybe like the wildland firefighters essentially, right? And so right now we're helping push forward their presumptive coverage, and we're helping them develop their response, measurement, and training materials around respiratory and dermal hazards. And I personally, so much of that stuff has to be converted to the public, right? Like I look at what we did at heat stress. Heat stress came out of firefighters too, and then we made it public. The smoking in Derval, you saw the smoke across Northern Ontario. It's already, I've heard stories of miners being underground and they're getting smoke pumped under to them, right? That's got to be a public awareness campaign. Yeah, need a partner on it. Just dropping all these seeds. Fatigue management, it still comes up all the time. I've done reports for individual companies to help them develop their fatigue management response system. Courtney's helped to go through what are the different systems that exist out there that you could use if you were trying to implement something into your company, right? And then the last one I put up, this one's an oldie but a goodie, I think. That one was actually done with Workplace Safety North. Mines were hiring more women, health and safety issues around pregnancies and fertility were coming up all the time. The hygienists didn't know how to answer the questions. So we partnered and jeepers, I think we $6,000 total to do this. We created the guide that is still downloaded and people still call me on this guide, and we've redone it. We've updated it for 2020. Well, at this point, it's not going to come out until 2026. Converted it into French because obviously, I mean, I think the goal right now is 25%, right, for ballet, anyways, of workers being females. And so this is coming up all the time. We also, less popular, I don't know why. When this one came out, the guys were like, "Where's ours?" And so we developed one for them as well. And it's kind of niche, but it's. Yeah, I love that. Okay, so I said we're training our future health and safety professionals. What examples did I give here? The one on the left here. This one I think was geologists across Canada had data that they had been collecting on injuries. And so we had a student analyze it and create kind of a program for them to understand their injuries. It was great for her. Like this can be a master's project for a student, right? And usually when we're funding these things, that's what we're looking for, is just to pay students so that they stay above the poverty line. Sorry, that's the unfortunate truth. The auditing, oh yeah, we've done lots of stuff with NORCAT too. I just threw that one up as an example, but we've done research with them. But we've also, they've hired so many of our students. I think they're the second cross in town now. But yeah, like we can help with materials that you're trying to prepare. And then some of the research we've done with Safe Work Associations, so again, Workplace Safety North, that was a big one because when the international conference came to town, the Mine Rescue Group asked us to help make it a more exciting, innovative conference. And so we did, we outfitted all of the, pretty much almost all, we had a terrific response rate. All of the participants wore wearable tech looking at heat stress, and we had them swallow a core temp pill while they did the very realistic 2-hour mine rescue simulation. Provided us with amazing data, provided us with lots of information on what's happening and what the risks are for these people, but also provided Mine Rescue internationally with different ways to consider heat stress management and move their risks forward. We partnered also with Workplace Safety North to help them develop the metrics around their mental health program. We all have to come up with quantitative assessments of how successful we're being, right? So we helped develop the surveys, and then we also helped analyze the results that came in when they did the presentations to help them inform themselves and the ministry how the program worked, right? Again, I guess I said in the previous slide, we've done lots of research studies. That one there is around testing out how their simulator training works in comparison to real life training. And then I put Andrew up there. Sorry, Andrew. I said there's a surprise there. But when we've done tons of things with OCOW too, but Andrew and I mean, we got to work together as when he was finishing his doctoral degree. I had the pleasure of supervising him. We don't get to do that too often, but that is something that, we've tried to do a couple of times is if you've got somebody in the organization who's trying to get a master's, actually, there's somebody now in WSN too that's also with us to get their master's. So that's something we can help with, and we can help figure out a project that fits with the needs of the workplace or of the SWAP. But then, so the work that he did benefited OCOW, benefited the public. And then we continue to partner on research in addition to, and it just strengthens the ties between the groups, right? Okay. What's my time? 11:10. That's not bad, right? That's 20 minutes. I don't think I have time for questions because nobody else got questions. So if you want to, and really, it takes me probably 2 days to get back to email, so you can contact the group. If I am at Storm and at Laurentian, just be big. As I'm sure is true for most of you. You try and get your email. But thank you for listening.
You're last. Absolutely have to say the best.
Thank you.
There.
Good morning, everyone. Thanks for having me. It's interesting. Like people were talking about not really having partnered with us and didn't know who we are. So yeah, I guess we're here. We're in the north. A lot of times we're working with hospitals, municipalities, education. So I imagine a lot of people that are in the room that are in different sectors. So that's probably a big part of that. I'm going to talk a little bit about who we are, and then I'll even explain a little bit about my background. I'm the main consultant in this region. So if you're going to connect with us, then probably going to be myself. It doesn't seem right. I skip forward too many times. Okay, so so we're part of the prevention system, right? So we're one of the Safe Work Associations. Like I said, the sectors that we're primarily servicing our healthcare, community, municipal education. Does involve also some Indigenous communities as well. So it's actually a lot of organizations covering a lot of workers. And, we do a lot of the similar services of what was spoken about this morning. So very, very interesting, right? Listening to hear not only the services that they're doing, but in relation to what we're doing, hearing about those partnerships. Yeah, so I think you'll see that as you go through this that we do a lot of the same things, but we tend to focus more on our own particular sector. And if, let's say, for example, somebody called us from the manufacturing or, forestry, mining, what I'll do is I'll spend time on the phone talking to them, but I very much will direct people back to your own particular safe work association, because I feel like they probably have that specific feel and culture that you're most accustomed to, right? So I just kind of, over the years, I've been doing health and safety for 25 years. I've been in this organization for 18, and I'm set up in the healthcare community team. And so one of the things I've kind of come to appreciate is that people who, like say health and safety professionals, I probably have a best fit within healthcare, right? There's just something about me that kind of has that sort of feel. And I think that's similar with my other colleagues in the various sectors, right? So if you take somebody that's from the north, that's being served by the WSN, they tend to resonate and have quite a feel that way. So it's not to say that we won't, and you'll see that there's a lot of services that we probably can support you around, but that's kind of the basis of how I kind of approach it. In terms of my background, so I've got a master's in industrial hygiene. I've got a Canadian Registered Safety Professional background in HR. I actually teach at the University of Waterloo in their occupational health and safety program there. So really trying to support HR folks. It's funny, like a lot of these organizations that we come from, we have specific specialty in health and safety, right? There's a safety specialist or an occ health nurse. But when you're in HR, this tends to be an add-on. So I really try to help bolster their knowledge and understanding of the legislation, because they often can be the first point of contact with folks like the Ministry of Labor come in. And I would say at the beginning of my career, I spent a lot of time doing technical stuff related to hygiene, right? So with industrial hygiene, we're talking about indoor air quality, chemical exposures, noise, heat stress, things like confined spaces. So did a lot of that kind of stuff. But as my role kind of expanded, I spent more time focused on doing auditing, right? So I worked for Jakes Whitford, which was an environmental engineering firm. So we would go around the north and go to oil and gas, mining companies, pulp and paper, so I remember the Bowater plant going up there, doing a health and safety and environmental compliance audit for them, TransCanada, right? So I spent a lot of my early years doing those sorts of things. But so I fell in love with auditing. I fell in love with management system type work. In more recent years, I've spent a lot of time thinking about and providing support around mental health, psychological health and safety in the workplace. So so when I think about our mission, right, obviously we want to make sure that people come back from the workplace safe and healthy, but I also think about it in terms of a holistic approach, right? So there's safety, there's health, there's well-being, and every situation really has a little bit of that involved. So we try to integrate that as much as possible, but I would say in more recent years, there's been a push for things related to mental health. So one of the things you'll see that I put on a lot of your desks is a tool called Radius. And I have a slide that speaks to that. But that's really a tool that's really trying to create a platform and a process to identify psychosocial risk factors in the workplace that would mitigate the harms related to psychosocial. So that's one of our more recent initiatives. So where did, like in our sector, so if you think about, you know, under municipal, right, we have policing, we have fire, we have EMS, but across all the sectors that we serve, when you think of the WSIB statistics, we see a lot of musculoskeletal injuries. So about 60% of our injuries come from that sector. I'm sure you guys are probably thinking, yeah, that's a big one for us too. So we have a lot of kinesiologists, a lot of ergonomists. We have people who, you know, were physio, or they were specialists working in places like the Canadian Back Institute, who do specialized services in these areas. So that's a big area. And if you imagine like somewhere like a hospital, right, all that client handling that they're doing, we really have to have strong, competent people in order to be able to come in and support them around that particular hazard. We actually have a project called EPIC, where we combined musculoskeletal disorders with slips and falls, because we figured, you know, slips and falls was like 21%. So what we're trying to do is just think about it, like if you're trying to prevent lost time injuries within our sector, if you combine those two, you basically get like 85, 90% of all the injuries. So coming in with both of those was a kind of a novel approach at the time. We also see a lot of workplace violence in our sectors. And so the Ministry of Health and Long-Term Care, the Ministry of Labor, they partnered with us and created a lot of funding over the last 10 years. So we kind of brought all this different stakeholders together and developed these toolkits. So we have this site, workplaceviolence.ca, which I'll show you in a minute, but it essentially created a lot of resources and tools around that. So we do a lot of risk assessments, and like I said, the psychosocial. So yeah, and then this is kind of new to me, this language. We've kind of changed things up, but I think it's pretty intuitive. So like all safe work associations, we do a lot of training. We have this second piece called applied and advisory services. So all the traditional consulting that we do is that advisory. So I think that makes sense, the word advisory. And then when we think about applied, they're talking about specialized services. So that's when you need beyond just a general consultant, you need some special project in order to achieve some outcome. So once we get into that and it's more resource intensive, we'll set up a contract to do that, and then you pay for that type of expertise. That being said, sometimes you just don't know what you don't know, and you want to know which direction to go in, you have full access to all those sort of specialized knowledge as well. Nobody's gonna not spend time with you on the phone answering all sorts of questions. But let's say you wanted a workstation assessment. You wanted one of our ergonomists to come out. Well, that would be something separate. And yeah, we don't, like myself, if you needed me to come out and visit you, let's say you're Health Sciences North and you want me to come out and visit and spend some time with your Joint Health and Safety Committee, give feedback to the Joint Health and Safety Committee, do a little bit of education for them. I don't charge for that, right? So the system partially funds my salary. And so there's a lot of the stuff that we do is just free, right? So if I've got expertise and I can come and help you, and that's no big deal, then for sure that's what I'm here to do and will continue to do. Yeah, so it's really we have sort of some different criteria that defines that, and then here we're talking about different types of services that like it could be some different type of technology or platforms. Yeah, so it's kind of a new area that our CEO is kind of trying to expand this product or services. And yeah, so if you think about, I heard this morning, Lindsay was talking about the maturity model, right? So every organization is on some sort of journey. And, you know, if we think about health and safety and trying to make a difference, right? What are the different types of beliefs that we need to have? We gotta believe that we're good abiding citizens and we want to make sure that we're complying with the law. So that's what all the compliance is about, right? So you hope that we get you to that type of thinking, and then we start providing you, supporting you around checklists, audits, to advance compliance. And then if you kind of move up, right, they talked about, you know, if you just think about hazards and risks. So compliance will not solve all your problems, right? That'll just get you so that you're getting your check marks with the ministry, gets them sort of off your back. But you still have your hazards, you still have your risks, you still got to manage those and ensure that you're effective in that regard. So in order to get that to work, you then have to start putting in good programs. You start thinking about it in terms of systems, right? What are all the various components of a management system that needs to be in place? So we have lots of things in place to support that as well. And then sometimes it's a matter of, you know, you don't want to do this just because of compliance and just because, you know, it controls loss, right? You also want to do it because you know it's the right thing. You care about each other. You don't want to see the harm and loss. So that's where you start doing best practice. You start looking at your excellence programs, right? You're trying to get things in place so people do it for the right time. Someone was talking about, I forget who it was, but which was talking quite passionately about creating a culture where you'll point, when you see something's not right, not being done properly, you have the courage to be able to say, you know, to speak up and to speak in that moment, right? You're doing that because you care about each other. It's a value. It's the right thing to do. And that's that excellence piece. That's that culture of safety that we're all striving to get to. So we have you know, different services for all of that. I should also say, okay, so I'm part of a team of 10, but we used to have about 15, but we have 10 health and safety consultants that are in the healthcare and community side. Okay? But there's about 35 consultants in total. Our whole organization has about 85. So within our team, we've got, occupational health nurses, a few hygienists, we've got safety professionals, or people with specialized credentials in ergonomics, kinesiology backgrounds, right? So I really do feel like we have an excellent team of qualified people who've got a lot of depth and experience there. We also have a municipal team. You know, a lot of the people that we hire have worked in those sectors, right? They've worked, you know, I worked at Sick Kids Hospital, I worked in biotech pharmaceutical, right? So that's kind of how I got into this. But there are others who worked in just policing, just in fire. You know, maybe they have an electrical background. EMS, we hire people that have worked in the ambulance services as well. So, yeah, I guess if you think about emergency services, confined spaces, working at heights, ropes and rescue type, right? So we have a gentleman who's got an immense amount of experience and depth in that as well. Yeah, there's a lot there. Risk assessments. Yeah, we get called in to do a lot of risk assessments. And I think a lot of it is infectious diseases. So I did quite a bit of work in the province with infectious disease threats, working in Ebola, COVID. My phone rang off the hook about people trying to solve how to best control and manage the exposures to COVID. because we did so much work in violence, we have so many people who specialize that. We did a lot of those types of risk assessments as well. A lot of calls come to me related to hygiene type questions as well. Yeah, so a lot of that kind of stuff. I think any one of the safety associations will do auditing, compliance, management system, specific hazard as well. We'll develop policies and programs as well. A lot of times, giving you best practice examples of what those look like is a good place to start. If you said, you know what, we can't do that ourselves, then we have people too that will do that. I feel like AI though has changed a lot of that, because you could take 3 or 4 different best practice documents, say specifically what you're looking for, what type of organization, and it probably could generate a lot of those as well. So I think that's probably a huge change that's happening across all our sectors. We do offer a lot of free things as well. So I don't spend a lot of time on my own website, to be honest with you. They recently had me go through and check, because they were moving from one website to another, so I'm kind of familiar with it, but I can't rattle off all the different free resources and templates. I would say though, for small businesses, we do have a small business guide, which is actually get people started. I feel like one of the things that me personally, that what makes me good at my job is I've got a lot of good knowledge and stuff, but I also see myself as a facilitator, right? So when I come in, it's not about just giving you a bunch of knowledge. I see myself as somebody who's going to help move the dial forward. If you've got, management and workers in a room, then I help bring people together. I find that common focus, identify where there might be gaps or opportunities where people could work better together. So I think it's probably our value is in the facilitation piece of things. And yeah, we get, every time we do a webinar, we save that and then we put it on our website. So a lot of the most popular webinars are the ones where the Ministry of Labor has come in, partnered with us, and they're about to do an initiative. Everybody wants to know what the ministry's going to focus on, some of the past things that they've identified. We do a lot of training. We've got the traditional classroom. We call that private training for whatever reason. Like it used to be, we just call it on-site training. But when they say private, they're just saying it's not a regional public. Okay, so we kind of differentiate private versus public. And then we do virtual versus on-site. So a lot of our certification training is done through a classroom, but in distance-wise, virtual. And that's just kind of the way the world went. I think a lot of employers like to save money that way. I think we would all agree that it's hard to replace a classroom environment like that and the connection that we get. So some employers still value that, and they will have us come out and still do that type of training for them. So we do quite a bit of that. And then we have a whole group of people who develop e-learning that will develop custom courses. You can contract them to develop pretty much anything you want, right? They'll develop e-learning courses, but they'll develop, because we got these graphic design people, and we just match up our expertise with them and then put that out there. So there's a lot of ability to do that. With the certification, they're just saying, like, how do you like to learn? So you might be like, I'm from the north, there's no way I can drive all the way to Toronto to go to that session. I have to do it through distance learning. Fair enough. Then somebody might say, let's say you're understaffed long-term care home, and it's hard for you to get off the floor. So your employer would prefer to pay you an extra in the evenings to do e-learning at your own pace. So they offer that as an option as well. So we try to make sure everybody's got what they want there. Yeah, so this is the design and build piece. So we have the ability to, with our instructional designers, team of writers, graphic artists. So they do produce a lot of exceptional looking materials and work. And so they're good. If you have a particular project or something you're looking for, they'll definitely be able to help you out. So right now, we've done quite a few webinars specifically around workplace violence. So we know that the ministry is in the middle of their compliance and their focused inspections. So in order to assist our clients with that, we have, I think there's like 3 webinars that have just sort of been released. All the safe work associations will put out information about their training, but they also have newsletters, right? So if you're not already part of the distribution list of your Safe Work Association, then I encourage you to go to the website, and then it'll say, you know, do you want to subscribe? Do that, because it's a great way to get connected with us, so that, you know, the latest and greatest stuff that we're putting out there, it's immediately coming to your inbox, and you can decide if it's something that interests you. So I'm just thinking, like yesterday or the day before, there was a bunch of information just put out about those webinars, and they're free webinars that you can access. So that gives a sense of some of the clients that we traditionally serve within the healthcare. So I took this set of slides I did a presentation for ONA, and I'm just in my head now realizing that doesn't have a lot of stuff there for the education of the municipal sectors, but so that's why you're specifically just seeing a focus here on the healthcare sector that we serve. And let's skip over this. This is really just a slide helping people understand what that inspection would look like if the ministry were to show up, and then what were some of the things that the ministry would focus on. So right now they're doing these workplace violence risk assessments. You know, people need to get a sense of, okay, this big scary Ministry of Labor inspectors coming, like what will they look like? What will that feel like? What's the process they will follow? Yeah, they're gonna, you know, definitely focus on, you guys all know the violence, probably read about section 3201, right? The workplace violence and learning about risk assessments. So they want to make sure people are doing these risk assessments and reporting. Yeah, these are the toolkits. So these, a lot of expertise went into the development of these. It started with a project called VARB, violence, aggression, what was it again? Responsive behaviors. And then I think that lasted about 3 or 4 years, and then it turned into the leadership table. And so they've continued to develop 3 or 4 additional toolkits. So if you have, I don't know why the font went weird on that. It looks like, it didn't look like that in my copy. It looks like an old-fashioned typewriter. That's kind of interesting. But if you do have like a lot of violence and you're looking for solutions around that, I know it's very much healthcare, has a healthcare feel to it, but there's a lot of great information in there. So like for example, if you want to learn about de-escalation, right? You know, that's an important thing to be able to know and understand in healthcare, but it can also have applicability to other sectors and anybody that's dealing with the public and trying to de-escalate those sorts of situations as well. So we have a code white one. We have, so a general risk assessment, we have a client-focused one. We have one around security, work refusals, accident investigations, transporting patients. So lots of great content there. There's actually another one around community of risk flagging. So kind of a controversial thing is when somebody has a history of violence in the healthcare sector comes in. If there has to be a means to communicate that, right? But how do you do that with a patient without creating stigma? So that particular toolkit is trying to do that in a way that all parties can agree with. So you know, I don't know if you guys remember in the news in London, there was some pushback around flagging with patients. So this is a kind of a document where people came together and figured it out. So the website is workplaceviolence.ca. It's separate from PHSA's website, and then there are different tools available. We have a lot of online risk assessment tools as well. So if you're trying to conduct a risk assessment, and some are specifically for healthcare, but some are also for all sectors. So it can be used by anyone. Some tools there for domestic violence, which could be of interest. So yeah, so Radius. So I put this out for people. So if you think about mental health, let's say your workforce was experiencing a lot of burnout, which is common across a lot of sectors, but you're not sure what's causing that, right? So it would take a specific job position. So in my world, let's say if you took a nurse working in an emergency department, right? This particular tool will create some structure so that you can assess that position, that job, and then it has, let's say, a list of 40 type of psychosocial risk factors, and you can kind of plug and play and add things, remove things, but it allows structure to document that assessment, but also create a little bit of a process around it as well. Yeah. So we're getting quite a bit of positive feedback and uptake on that as well. It says it's free. It initially was free, and then I think they charge some nominal fee for it now. So with the psychological health and safety, there's a number of different resources available. So I know WSPS, they have services in this area as well. Same with Workplace Safety North. Infrastructure probably, but I don't actually know their products well enough to speak to them. But I would say with HSA, they focused on program development. So, you know, the gold standard is to have everything in place, have a management system, right? Create a really strong culture around supporting people around mental health. Like, I mean, that's ultimately what you want to do. But when people are starting out, they often don't even have policies and procedures, right? They're just building those basic programs. So this is a guide, a free guide that's on, you can get it off of, you know, our website, off the internet for free, really downloadable. And it really focuses on, you know, that primary, secondary, and tertiary approach. So let's prevent mental health harm or psychological injury, right? When we start to see signs of this, or people are reporting issues, you know, that's the secondary ones. We got to, you know, take action, response. So people might investigate, report and investigate those types of instances. And then you got your tertiary aspects of this as well. So they're trying to make sure that the basic programs from a health protection point of view includes all. So I think it kind of helps clients bridge that gap to the CSA standard. You guys are all familiar with the CSAs that is it 1003? Right, it's not working. Right, that one is more focused on putting a complete management system in place. But you might not be ready to get there quite yet. So they have this, and then they have a gap analysis tool that can be used to assist with that. And the guide itself has a ton of, one of my friends, Jeremy Holden and Tegan, put together this guide that has all sorts of resources as well. So it kind of helps you, punch in different directions. So this is just from our website. You'll see there's like a lot of different consultants that we have. Kind of unique to PHSA that we have like 2 AI consultants, not just 2 robots. I'm actually the new robot. No, everybody's human, which is kind of nice. It's the future. Get ready for it. Yeah, so these are all really nice, lovely people. We're spread across the province. We work as one team. But let's say you asked me to come in and do an ergonomic assessment. Like I could do a workstation assessment, but we have some people who are, they have a master's in ergonomics. They have a master's in kinesiology. Why would I not just connect you with them and you can get the absolute best type of service, right? Like Nathan does wellness. She's an ergonomist. Tina does a lot of the workplace violence and also does a lot with infection prevention control. Alina, she's an occupational health nurse, same as Tina. Camille works he's located in Toronto, but he's responsible for Thunder Bay. So some of you guys might know him. But I think he's originally a doctor trained in Pakistan. So he's been in our organization for over 20 years. That has that background. Anyway, we'll go through everybody there, but just we've got an excellent team. Yeah, I think that's the end of my presentation there. So yeah, thanks for, actually before you guys, I gave you the flashlight. So before I forget, if you get into work, you have to unscrew this part and there's a little plastic thing in there that has to be removed and then it will work. Okay, so yeah, thank you for giving me the time to speak to you guys and hopefully I'll get to interact with you guys over the years.
Thanks, everybody. So let's go to the absolute last slide, because that does conclude our presentation and event for today. Concludes the online portion. So for those of you who are here, please feel free to stick around. We will be sticking around, answering questions and chatting. Thanks, everyone, for coming today. I really appreciate it. Thank you.